Hi, everyone, and welcome to Dementia Chats. This is Lori La Bey, and Dementia Chats was started because my mother had dementia for 30 years, and I just thought the voice of those living with the disease is critical to hear. And so we're going to go around and have everyone introduce themselves. And from there, we are going to hop into a conversation about suicide, which is a big issue that needs to be addressed. So, Harry, if you wouldn't mind starting.
My name's Harry Urban. I've been living with a diagnosis of Alzheimer's now for 16 years. And I found that there's a better way of caring for people like us living this disease. And that's the path I'm pursuing right now, that we can live a long life with this disease if we know how to increase the functionality with living with this disease.
Great. Thank you, Harry. Michael?
My name's Mike Wallenbogen. I'm an international dementia advocate and connector, and I've been living with disease for who knows how long at this point in time. It's been a long time, and I don't have a conclusive diagnosis, but it's most likely semantic dementia or either Alzheimer's or possibly even both.
Thank you. And Creaky?
Hi, Karen Creekmore from Corpus Christi, Texas, and I was diagnosed with unspecified symptoms of dementia in 2014, and I was 59. Actively involved in Dementia Mentors Virtual Cafe, DAA, and other groups, and also started a local cafe here in Corpus, Memory Cafe.
Wonderful. Thank you. Pauline?
Hi, my name is Pauline Gordon, and I live in Arizona. I was diagnosed with vascular dementia 8 years ago, and I'm very involved in a couple of different groups, Dementia Mentors and Dementia Action Alliance, and I just keep real busy advocating.
Wonderful. Thank you. And we're hoping that Craig is going to be able to join us, but he's having some internet issues. So if we get another person that pops on, you'll know why. Elon?
So my name is Elon Caspi. Both my grandmothers had dementia. I've been in the aging field working in different ways over the past 25 years. I'm here to learn from the real teachers, people living with dementia, about your lived experience. We honestly believe that you are the best teachers, and maybe share something that I learned along the way. I would want to add with regards to this topic today, that is complex, charged, and there's a lot of subtleties to it, and a lot of ethical issues, and I love what Harry said before the program started today, that it's a very personal decision. So I hope we can model for others today how to be respectful to others' opinions and thoughts in this complex and emotionally charged issue, and respect individual choices in this regard.
Thank you. And Craig made it. Okay, you want to go ahead and introduce yourself?
My name is Craig Henke. I'm from Milwaukee, Wisconsin. I have Lewy body dementia. I'm involved in Dementia Mentors and Forget Me Not groups.
Wonderful. Thank you so much. So our conversation today is going to be about suicide, which, as Elon said, is a really touchy subject, but it is one that the thoughts go by many who are diagnosed with dementia. And I think probably with most chronic illnesses, when there's a depression that follows a disease like that. So we're just going to have everybody talk honestly and openly regarding their feelings on this topic. And Harry, if you don't mind kicking us off on this, I would appreciate it.
I think that suicide is a emotional, very emotional, and it's not just with people living with dementia. It affects anybody, and I walk a thin line on this because I don't believe in suicide, because I found my life on giving hope to people to get over the bumps in their life, find a way to get around this, and go on. But on the other side of the fence is the issue of the right to die, which is so many states now are passing that law that you have the right to die. And I think that's right, but I think us living with this disease, we get to a point where we can't make that decision. Because if we're having a bad day, we might say, oh my God, I wish this was over. You know, I can't take this anymore. Now, to somebody outside the circle, they might see that as a suicidal threat. You know, so it's hard for me. It's hard for me because I mentor a lot of people in our memory cafes that have these thoughts. And now I don't practice medicine. I don't, you know, that's not me. But I can give them hope. I can listen to them and things like that. And I can guide them to the people that can give them the hope. And it's an epidemic. You know, now we hide this whole suicide behind the scene, and we don't think about it, but we don't know how huge it is. You know, it affects so many people.
Here, you had mentioned before we started recording the fact that sometimes people are just venting, and you know, it isn't necessarily a step that they're going to take, but they just need to be heard how frustrated they are, and yet sometimes others take it as a suicidal comment and then call somebody in, and the repercussions of that. Can you expand on that a little?
Yeah, that's a lot of times we vent, and I think it's healthy to vent as long as it's a controlled vent. And sometimes we say something and somebody misinterprets what we're saying. They don't see it as a vent. They see it as a threat. They see it as an action plan. And they call into the police a wellness check on the person. Now, once you get into that legal part of it, they have to investigate. And it can cause a lot of legal issues for you. Instead of trying to contact the person and see if they were just venting or if they do need medical help. You know, we always jump to the conclusion that they're suicidal. I can use my own experience. Sometimes I get very emotional about a topic, and somebody says, "Oh my God, he's suicidal." No, that's not it at all. You know, we have to learn more about this disease. We have to understand. We have to stop thinking just because somebody says something and they're going to act on it. Now, you can't ignore it. That's not what I'm saying. You can't ignore it, but you can't over-respond to it. Because, like in my case, they planted the seed. I might be suicidal. Now, that happened years ago, but every time I get upset, I think, oh my God, am I suicidal? And that's so unfair to us.
Thank you, Harry. Cricky, how about you? Do you mind jumping in? Then I'll go to you, Pauline.
Yeah, I think a lot of times, at least the friends that I have, we've had a lot of issues going back and forth with being really depressed or suicidal. And a lot of times for myself, I didn't know how to react. Like if my friends were talking that way, if I were to say, are you suicidal? You know, that might trigger them, you know, to be more suicidal. And what I found is that you just can't ignore someone's plea. That's, to me, is their plea for help. And for me to just come out and say that, and then, you know, listen, like Harry said, we've just got to be good listeners and have an action plan afterwards, the 1-800 number, and make sure not to leave them alone. Accountability for me, you know, just having a friend, knowing that I wasn't by myself, made a big difference.
Great, thank you. Pauline, you had a comment?
Yeah, I have a couple comments. I agree a lot with what Harry was saying, and I too believe that people have a right to die. I'll tell you why. My dad had Alzheimer's, and I watched him at the end stages, and he couldn't walk. He couldn't even sit in a wheelchair. He kept falling out of the wheelchair. He couldn't eat. Didn't know anybody. I mean, it was horrible. I you know, to the end stage, when someone gets to the end stage like that, I really think they should have the right to go. I hated. I couldn't stand to see him in that condition, and he was miserable. You know, he was just miserable. So, you know, I have that feeling about it. Now, on the other hand, I think that people shouldn't approach this prematurely. I agree with Harry in that there's a lot of living that can be done after a dementia diagnosis. And I would prefer to give people who are newly diagnosed hope and help them to develop strategies to make their lives easier. And so that would be my first approach, and I would keep it as a last resort end stage, and I guess I would be for it at that point.
Okay, wonderful, thank you. Craig, any thoughts from you?
Yes, this is a very fluid subject for me. I just got over my last day of therapy was yesterday for suicide. In early December, I had suicidal ideations because of the dementia, mostly because I wasn't sleeping. I was getting 0 to maybe 1 hour of sleep a night for about a month. And I wasn't thinking right, mostly because of that, because I just didn't have the right mindset because I wasn't sleeping. And that alone had a very, very big effect on me. I was in this very dark, lonely, selfish situation, if you want to call it that. And my wife realized that, and I had an appointment with my therapist, and she suggested that I go into the hospital, and I did. And looking back now at it, I'm glad I did, because what came out of that was a huge adjustment to my medications. They found the right medications, and now I'm sleeping on average minimum 4 hours to 6 hours of sleep a night, which is huge. And did a lot of investigations on my medications that I was on, because the night terrors, in addition to not sleeping, when I was sleeping, I would have night terrors. And for people that haven't had them, you can't describe them. They're so realistic, so lifelike. I used to wake up from the night terrors and was still in the night terror. I would be in a situation where I would smell something and wake up, I would still smell that burning wood, for instance. They were that real. So it was hard to get out of that thought pattern for a while, but I just got done with therapy for 2.5 months. And the therapy worked really, really well, and now I'm in a lot better situation. I've got a newfound relationship with God, and a lot of more self-worth. I looked at my blessings in life and my things in life that made me happy, and my grandkids and my family. and realized that there was a lot more to live for, and doing well now.
Well, that's fantastic to hear, and I, I appreciate you sharing that with us, because sometimes people wonder what is the process. And did you go to the doctor on your own, or can you mind sharing how that happened, how you got into therapy?
I actually had an appointment with my doctor for about 2 months, and this was boiling up to that point. And as we talked to the doctor, I did mention the suicidal ideations, and she suggested I go to a hospital immediately, which is another issue because trying to get into the hospitals, they're so this suicide is so big that hospitals are turning people away because there's just not enough room for people. So at the very last minute, they actually found a place for me to go. It was a great hospital, great staff, very caring staff, and they were very, very on to me not sleeping. And it was a big thing with the nurses. They were fantastic in getting me the help. They would check on me every half an hour, make sure if I was sleeping well, adjusting my medications as needed. And like I said, it made a huge difference in my sleep pattern because the medications that I was on were some of the worst medications you could be on for Lewy body dementia. They made a mistake there that they put me on Benadryl to help me sleep. And Benadryl, found out later that Benadryl is one of the worst medications you can be on for Lewy body dementia. And when in regards to the night terrors, I came upon this myself about 3 weeks ago. I was looking at all my medications and found out that statin drugs have a direct correlation with night terrors. So I stopped taking my statin drugs at night and took them in the morning now, and thank God, in about 3 weeks now, I haven't had a night terror. And that is really big because people that experience them know what I'm talking about, but it's like a nightmare, but you act it out. I actually jumped out of bed twice now, and hurt myself once. But the night terrors alone and the lack of sleep is what put me in that situation.
Well, that's a really good point, mentioning the medications, and it's sad that more doctors don't understand, and that there's not some kind of checkpoint somewhere to make sure that we're not giving people these medications with adverse reactions to certain drugs. I mean, we should be beyond that at this stage of the game, is kind of my thought. So thank you for sharing that with us. I think that's really helpful for people. And I think sometimes people don't understand what lack of sleep can do to the mind. And you were talking about 4 to 6 hours, where they're still saying we should get, at least 8 hours. You're still under the recommended dose of sleep, but yet it's making a huge, huge difference, it sounds like, for you to get that 4 to 6 hours. And that can happen to anybody at any stage of life. That sleep is critical in terms of our functioning. So thank you, Craig. Appreciate it. Anybody have any comments on Craig's points? Okay, Pauline?
I think that the whole medication issue, the whole fact that the medication was actually causing problems that you were previously on, I think that that's a really important issue to be aware of. And I think we have to be much more careful when we take medications from our doctors. My doctor just prescribed something that I think is a terrible medication. I was looking through, and there's all kinds of terrible warnings about it. Now, I have the right to not take that, if I choose not to take that. So I think that we have to be very good stewards of ourselves and look up these medications and really check them out, or check with another doctor, or do something, because they're very they can cause a lot of problems.
I agree. And you can go to the pharmacist and have them review your medications for what you're on. And I think sometimes coming from a pharmacist carries a little more weight than you or I going, well, we don't agree with you. But then they'll usually come with another type of medication to replace it with. Harry, you had a comment?
Yeah, I'm gonna share a story with you that I shared with Craig. And this happened when I was in my early 20s. But you don't know the feelings of emotions of standing on the edge of a cliff with your toes hanging over, trying to decide if you want to jump off or not. Now, back in those days, the pressures that I was under was so great. I saw suicide as a way out. And I was going to use a shotgun. I was going to blow my head off. But the only thing I did is I blew off the tip of my finger. Well, I spent 3 months in a mental hospital. But you know what? I had the best care because they could have just medicated me to mask my problems. Oh, Harry, you're depressed. Here's a pill to do it. But they worked with me. Harry, why are you depressed? And I think that's why my passion is the way it is, because I don't think medication is the answer. I'm not saying we don't need medication, but we are so far over medicated that it's horrible. And unfortunately, there's big bucks behind it, so that's not going to change. That's why I am really pushing now for different methods of caring for us. When somebody is standing on that edge of that cliff, trying to make that decision, you have to help them. Medicating is not going to do it. You have to walk up to that cliff with them, stand with them, talk to them, and listen to them. Then, and only then, can you have that person back up from that cliff. And I think that's why I always say you have to live this disease before you know what you're talking about. Now, I always say I spent a lot of time on the dark side of dementia, and that's just not a saying. That's fact. I know what it's like. I know what it's like to have suicidal thoughts. And I know what it takes to help me. And that's the message I'm trying to get out so much, that there is other ways. There's other ways to do this. Now, this is a very passionate topic for me, and please forgive me from getting emotional, but we have to start understanding what it is, and we have to start learning the emotions of this disease instead of jumping to conclusions. Now, my doctor will not prescribe any new medication to me because he knows better. Now, if my life depended on it, of course, that's a different story. But if a new pill comes out on the market, well, let's see what this does. I'm sorry. No, it's not good. Now, I came up with a series of questions to ask your doctor when they try to prescribe a medication to you, like what's side effects, is there an alternative method besides taking medication for this? And it's helping so many people understand that just because your doctor says take this pill doesn't mean you have to. You know, if you have concerns, get a second, third, fourth opinion. And like you said, your pharmacist knows more about that than your doctor does because they are trained in that.
Thank you, Harry. We haven't heard from Michael yet. So, Michael, what are your thoughts on this topic?
I got to tell you, this is a very controversial topic, and we really need to ask why we are where we're at today with this. I don't like to look at it as suicide. I like to look at it as right to die. But because we don't have the laws in place for right to die, it becomes suicide. And I think if we fix the laws and change the laws, we save lives. And let me explain what I mean by that. I have a very, very sophisticated advanced directive. It's like 32 pages. It goes into all kinds of details under what conditions I should no longer be fed. The big problem with that is, in order for that to take effect, I still have to have my cognitive abilities so they can act on it. I mean, if you and I, God forbid, had cancer today, and you're in so much pain, you can tell that doctor, hey, doctor, just let me go. I can't deal with this anymore. Just let me go through hospice, and that's it. They put you on your way. It's not talked about today, but they give you all these meds to make you nice and comfortable, and you slowly pass away. We don't have that luxury as a person who has dementia. We know what's ahead of us towards the very end, and it can be very bad for us. But yet we don't have the same rights as other people. I mean, there's states now that have right to die laws that actually assist people with two medical doctors approving that they can take some sort of cocktail, and it's okay for them. But yet for people like us, we don't have that right. And that's a serious issue because of that. As we know, we lost a dear friend, a close dear friend to us, who felt that she didn't want to become that person and didn't want to end up there. And sadly, she took her life way, way, way too early, way too early. And she knew it. She knew it. But the fear in her mind was the same fear that I also have and many other people who are living with dementia. Well, if I don't do it now and act now, I might not have the capability to do that on my own. So what do these people do? They end up committing suicide when they could have had 5, 6, or maybe even some of us 10 years. I mean, my God, who would have known that today? I think I'm probably going on about 20 years. I had this thought back over 10 years ago. What would have happened if I acted on it then? What would have happened? I mean, I would have lost all these years. And look, I'm still taking and going. So it's we don't know when that final time comes to us. We just don't know. I mean, a friend of mine who was dealing with her husband 24 years. 24 years. In those 24 years, he was probably living 18 of them in the worst stages. 18. Can you imagine what that caregiver had to go through for 18 years? He was in a bed, unable to do anything. The one thing that she told me over and over, Mike, I never knew his wishes. Because if she knew his wishes, she probably would have figured out a way to let him go. But he never allowed her to know what his wishes were early on. That's why it's incredibly important for us, while we're cognitively able, for ones who may want to deal with that down the road, who don't want to be around when they get to a certain point. And again, everybody's point may be different. You know, some people might say that, hey, you know, the minute I'm in diapers and things like that, or no longer recognize my family, that you want to go at that point in time. And today you legally can do that. If you wanted to stop eating today and just, it will take you 7 to 14 days to not take fluids and food, and you would pass away. Legally, they cannot stop you from doing that. You would be allowed to do that. But the minute you have cognitive issues and can no longer understand that, they would have to stop you. So I think what's important is that we change the laws today. And by changing the laws and just letting certain people feel comfortable that if you go down that path under certain conditions, then they will act and help you, I think that will save a lot of lives, because so many of us have this fear. And that fear is what's causing the people to take their lives early. I can't begin to tell you how many people I've spoken with that if they had those things in place, they would not have committed suicide, or they wouldn't hasten, thinking about doing the things. And that's part of the problem, because there's a lot of people that just want that comfort feeling that, hey, I'm in control of my life and I can take it whenever I want to, but that doesn't mean I'm going to. But again, it's all about the laws. And I think we're going to get there. There's no doubt in my mind. Canada just finally approved it. Canada, I mean, the U.S. follows a lot of stuff that Canada does, but they just finally approved it for people with dementia. There's some talks right now going on, and so it's actually going to happen there. It's been a long time. They've been trying to fight this. So I guess what I'm saying is, whether you believe in this or not, I think we need to try to convince and change the laws, because by changing the laws, we will save lives. And that's the key. And that's something I'm working on. As I indicated, I am working with some team of lawyers out of DC and a number of other places, and we're just getting ready to start things here. And that's my goal. I think we will make things so much better for so many of us. And I don't want anybody to have to go through to be thinking about this every single day, just like Still Alice did. Because she had to remind herself every single day to think about where her drugs were, that she could remember to take them and how to take them and when to take them. Why should anybody have to focus the rest of their life thinking that way because they have dementia? Like Harry said, we should have hope. We should be living our lives, enjoying our lives. And if we put that paperwork in place, it should take action for us automatically without us have to ever give it a second thought, and enjoy our lives. Not to have to focus on the negativity of ending our lives or possibly thinking about suicide because today's a problem or tomorrow's a problem that we may not remember how to do it. We shouldn't have to be thinking about that. If the laws allow us to do it right, we would be able to enjoy our lives.
Thank you, Michael. Harry, you have your hand up, and then Pauline.
Yeah, okay. Suicide is like a religious issue. Now, we all were taught if you commit suicide, you never go to heaven. Now, I question that. I talked to several ministers about this, and they all concluded that if you put yourself in the judgment state, that you say, I'm the better judge than somebody else, yes, you will not go to heaven. But it's like somebody that wants to be taken off a feeding tube and let nature take its course. That's not viewed as suicide, even though they're going to die. I don't want to take up all the time with my thoughts, but so we could spend hours talking about this, and people don't understand. When I go to my memory cafes and I say that that we're going to have a speaker come in and speak to us for 15 minutes from hospice. Nobody wants to come. Nobody wants to hear about death. Robin Williams, if he would have got the help he needed, he'd still be alive today. But nobody was smart enough to know the emotional side, what that man was going through. We didn't know. So he made that decision on his own that he was going to die. So many people want to take the easy way out, and there is no easy way out. Nobody thinks of the afterlife. Now, I don't want to get into that topic. You know, that's another topic, but it's one I believe in, and there is no easy way out. You know, now we have to explain people. I always like to get on the topic if somebody have thoughts of suicide and then follow the action plan. Why? What convinced you not to do what you had in mind? And 9 times out of 10, you're going to find out there was some event, was something that gave them that spark of hope. That one thing that they wanted to grasp onto. And that carried them through so they wouldn't commit suicide.
Thank you. I'm going to go to Paul Ann and then to Michael.
I just wanted to share a little bit. When I was growing up, I was in a very abusive situation, and when I was 14, I decided to take my life. So I drank 1.5 cups of turpentine. I know, it wasn't good. But I guess at some point, there was a sparkling of hope in me that said, I should tell somebody I've done this. And I did. And of course, I went to the hospital and all that. But I started seeing a psychiatrist after that and went on antidepressants, which I was on for years and saw a psychiatrist for years and everything else. But I look back and I think about that, and I think I was 14. Just think of all I would have missed in my life. And I think of, all my children. I have children, I have grandchildren, I have all of this stuff. I now have dementia, and it doesn't, I have dementia, and I don't have those suicidal tendencies, right now, because it's not that bad for me right now. But I understand it. I understand the feeling, and I understand the motivation. And I think that it's a very difficult thing, but I think, I look back and think of where am I today, and I'll look at the people I'm helping today. I wouldn't have been here. So I think we can reach out and we can share our experiences, and we can help others with the negative experiences we've had in the past.
Thank you for sharing that, Paulette. Really appreciate it. Michael, you had a comment?
This is not for everybody, by far. And, there's a lot of religious beliefs out there. And again, you go with your own religious beliefs and what you believe in and everything, But if this makes you feel a little bit more comfortable, Harry, Dr. Stanley Terman has done a lot of investigation into this. He's met with the highest scholars and the religious leaders out there. I think it's 6 or 7 of them. I don't remember exactly. He'll probably correct me after he hears this thing here. But out of the 6 or 7 that were out there, he had convinced them all that it was okay to go down this path, to stop eating because of this and fluids. They were finally okay with this, except for 2 that he still had to work on and to convince them. But they all agreed under the particular circumstances and conditions with dealing with the top issues related to dementia, once people got to these real bad times, that they accepted that was okay, and the churches and those religions agreed that it was acceptable, that they would not fight it in the courts, because that was the whole point of this. he didn't want to get into situations where he was going to ask the people to do this, and they would have to fight in the courts because they would be against it. So I don't know where he's at today, but I can tell you as of 4 years ago, he had the majority of different religions to accept this.
Okay, saw somebody else's hand raised. Elon?
Very, very important, very powerful, very meaningful. I'm learning a lot. But I honestly believe, I see you all talking about it, and I see you all sitting, I'm envisioning all you sitting on a national panel in a conference such as American Society on Aging or Gerontological Society of Aging and other conferences, or those that are dedicated to this issue, and really having an experts panel yourselves talking about it candidly, just you do here today in this small conversation. And I think it would be tremendously powerful and very, very useful. It will open eyes of a lot of professionals, and I just see a lot of potential for that. Now, I know there's issues of funding and logistics and getting you all in one place, and I get that, but I just can't help but just say that.
Michael?
First of all, I like what you just said. I think I'm going to share this with my legal team, and maybe you folks might all be a part of it if they want to think about having you, because I agree with you. There's a lot of expertise here with some real true stories that I think could help a lot of people. But one thing I want to touch on that I didn't touch on is I think we shouldn't overlook the fact of medications, because I think medications could really help a lot of people. Again, I'm on antidepressant medication and anxiety medication, and I don't know how I would be today if it wasn't for being on those things. I will tell you, the reason I went on them was not because I was depressed. I went on them because I was having difficulty with noise and anxiety and all these things, and that's why they put me on these things, and it helped me from that perspective. But I might be getting other benefits of it where I may not be depressed because of that stuff, so I don't know. But the one thing I got to say is I would not say that people can always do it without the medication, because I do believe there's people out there that need the help of medication, and I would not want to encourage that medication doesn't help. So I think it's very important to remember that.
It looks like Elon remembered what he forgot. So go ahead, Elon.
So what I meant to say, I meant to actually ask, and kind of, I don't want to steer the conversation completely in a different direction. But my question to you all is, how do you see, because that's what you do on a daily basis, right? A lot of you, how do you see the role of peer support? So people living with dementia who are supporting people who have this ideation or intention. From your experience, do you find that it helps, or what are your thoughts about the role of peer support in the context of suicide ideation in people with dementia?
I think that's a great question. I'm going to start with having Craig address that.
One thing I forgot to say before is that I want people to know that they're not alone in this thought pattern. When I was at that point, I didn't care what my religious beliefs were. I didn't care that I had grandchildren. I didn't care that I had a loving wife. But being reminded of that is what brought me out of this. And I also wanted to say that, Elon's saying with peer support, suicide crosses all boundaries. When I was in the hospital, there was doctors, nurses, gangbangers, drug addicts, professors, just your average everyday cook and waitress and manufacturing people working in factories. Suicide doesn't care who you are or what you are. But being around these different people and learning that it affects everybody, and having that peer support was really big. You need that gentle reminder and constant reminder of what you have in life and what's there and what your benefits are. And the peer pressure, peer support was really fundamental in getting me back to where I should be. So, and I wanted to say too that I like how they have it listed here. It's not the National Suicide Prevention Hotline or Crisis Line. They call it the National Suicide Prevention Lifeline. And I like that wording. And that number is 1-800-273-8255. I know in Wisconsin there's other numbers you can call, like 211. There's a suicide hotline, I believe, also. But yeah, I just want to let people know that you're not alone in this, and suicide affects everyone.
Excellent point. And thanks for that number. I was going to give that a shout out. So appreciate that. Creaky, how about you?
Yeah, peer support was just absolutely instrumental. I have in Corpus an incredible support groups, friends that are just wonderful. And my dad was in mid-stage Alzheimer's when I was diagnosed. All I saw was where he was going, and of course that big stigma that we have, the image of dementia, in the older stages, and the horrible things that happened. And I was definitely suicidal. My friends were there, but I hadn't told a soul until I got online with Dementia Mentors, and it was like people understood where I was coming from. I had the peer support. I need the local peer support. I love everybody here, and I need the people that are going through what I'm going through to help us know that there's life after diagnosis. I didn't know. I thought you got diagnosed and you were dead. You were mindless and you were gone. And it is not true. And I get online and I see my friends advocating and enjoying life. And I know that's what's available. I have a choice. And today I just live in the moment and try to do what we can do to pass the word along.
Wonderful. Thank you. Michael, any comments on peer support?
Yeah, I've been there many times to talk to people about this who wanted to talk about this topic, and I don't encourage them one way or the other. I give them the true facts. I don't know how many people here have checked into it. It's not that easy to take your life. It really isn't. Especially if you're like most people with dementia who had to give up their guns, and you don't have guns in the house anymore. So it's not an easy thing anymore. But I always try to encourage them to not go that path. But if they want to, I make sure they know all the details and everything. And, I've had my long talks with Dina, believe it or not, and she had made up her mind. It's a shame. Some people will do that. And, I have to have respect for those people, no matter what. I disagree, but I still have to have the respect because we know our own selves best and know when we can pull the plug, as Dr. Steen would say. Sometimes it's tough. It really is. I can tell you, as a part of working with lawyers, I one time made the statement that what's it going to take something like something to happen to somebody like me or something before I'm drawing a blank. Before the laws will change for this. And my doctor was a part of our team. Well, believe it or not, he called the police right away thinking that I was going to commit suicide. I had the police knocking at my door because of this. So I've been there. I know what it's like, for them. But the cops were great. They came, they talked to me, and they saw I was okay. They looked at my conversations online that I had. They saw, oh, you're an advocate. They saw that it was kind of more of a joke type thing. But it's scary because if you make a statement, you're right. It could really be against you. And my God, they could put you in a 72-hour holding all of a sudden because of that. So, a lot of people don't even want to talk about these things for that reason, and that's bad. We need to allow people to talk about these things without suddenly the fear of going to a 72-hour hold or something like that. And this discussion, I think, is going to help many.
I totally agree with you on that. I think this has been a fascinating conversation, and I appreciate all of you being so brave to tackle this topic. Paulette, how about you? Any thoughts on supportive peers?
Well, the only thing I wanted to end with, I want to make sure, because we have a lot of people that counsel other people with dementia, and are mentoring or different positions, different situations like that. And I just want to caution them that taking that move to call adult protective services is a very big step and shouldn't be taken lightly. And so therefore, the recommendation that I would have is that to talk to the family, go to the family members and talk to them. If you have major concerns, that's where I would go first.
Good comment. Harry, how about you?
I think peer pressure comes in different flavors. Or peer support. Maybe that's what I'm trying to say. Now you have the people that, oh, honey, everything's going to be okay. That's the kind of support they give. And I'm thinking, my God, you have no idea what you're talking about. And then there's the people that walk the walk. They know what they're talking about. That's why I get so upset with a lot of doctors. Yes, they're smart. Yes, they have a lot of education. But you know what? They never walk the walk. They don't know what the emotions are like. They know what the medical side is, but they don't know and understand the emotions. And until they do, they're never going to understand this. They're never going to be able to treat us. Stop trying to fix us and help us live with this disease.
Thank you. I want to thank all of you. This was a really great conversation. I know it was a difficult one. The bravery you all showed for sharing personal stories is pretty remarkable, and I think will, again, help a lot of people look at this maybe a little bit differently. The point that was taken that Craig had met, that suicide is much like dementia. It knows no borders, it has no boundaries, and it can hit anybody at any time. And we need to be there for one another. We need to take the shame and the stigma from this, just like we do dementia, so that people are willing to talk about it, so that we can make some progress and some headway that makes sense, and get some laws changed, and understand that you can't just lock somebody up and think they're going to get fixed. We have to go much deeper than that, and we have to have that support. I love the idea of the panel of experts, and anyone listening, maybe there's a grant out there that could be written just for this topic, to get this funded, because this is a really important topic. If you think for 1 second, suicidal thoughts aren't common in people with dementia, and those that care for them, you're missing the boat. It's just not discussed, and we need to take the fear and the shame out of this. So again, if you're having suicidal thoughts and you want some help, you can call the 1-800 number, and that is 800-273-8255. That's 800-273-8255. And again, thank you, Craig, for looking that up. Again, thank you all for participating in Dementia Chats. I am amazed every single time we do one of these, because you really do shine a light on an important topic. And granted, we never know what that topic's going to be until about 30 minutes before we get together, but it's always a good one. Elon, any last words that you'd like to wrap up with?
I'm just taking everything in, and I'm just feel so fortunate to be here sitting, listening to all this. So thank you all for sharing from amazing insights. Hundreds of thousands of people across the country should should hear and listen.
Well, until next time, we will catch you guys all later. Thanks again. Bye now.
Goodbye.